Welcome to Nothing Without Us, a disability advocacy podcast produced by Lakeshore Foundation. I'm your host, Alie B, and today we have one of my personal heroes on the podcast, Dr. Dawn DeCarlo. Dr. DeCarlo received her Doctor of Optometry and Master of Science degrees from the UAB School of Optometry in 1992. She earned her Master of Science in Public Health in 2012 and her PhD in Vision Science in 2020, also from UAB. Go Blazers. From 2005 to 2023, she was a member of the UAB Department of Ophthalmology and Visual Sciences and director of the UAB Center for Low Vision Rehabilitation. She's a diplomat of the Low Vision section of the American Academy of Optometry. Her research has been funded by the NIH/National Eye Institute and the National Institute for Disability, Independent Living, and Rehabilitation Research, and the research has focused on reading and vision impairment. She's been the CEO of Sightsavers America since 2023. Sightsavers serves children in 16 states and operates 3 programs that fulfill their mission of identifying and securing treatment for unmet vision and health needs. Sightsavers operates 3 specific programs: a low vision and blindness program, an eye care program, and a vision screening program. And like I said, Dr. DeCarlo is one of my own personal heroes. Welcome, Dr. DeCarlo.
Thanks, Alie B.
I really want to know, as we get started, why low vision and blindness and why optometry school in the first place?
Oh, that's a very strange question for me to answer because, back when I was looking at schools, there was no internet. So I took myself to the public library, sat down in the career section and started pulling out books. And I fell upon optometry. It seemed like a good fit, didn't like blood, didn't really want to be a medical doctor. So I wanted a way to help people. And I ended up going to optometry school. And while I was in optometry school, everybody is very fascinated by eye disease and treatment of eye disease and things like that. But there are a group of people that can't be helped with medicine, surgery, glasses, or contacts. And I just became very interested in that part of the field. And so I did a residency in vision rehabilitation. And then my career path just seemed to gravitate towards helping people with permanent vision impairment.
That's incredible and so, so important. You personally have inspired me a lot since I was 13 years old. Do you remember the person or people or patients that inspired you to do the advocacy work that you're doing today?
So, yes, I have dozens of patients, more than dozens of patients that inspire me every day. I do remember that 13-year-old girl who came into my eye clinic and found out that she could drive when she thought she'd never be able to drive. And her inspiration to help others to make sure they had the same access as she did was one of the most inspiring things that ever happened. So I would say, I know that this is not the purpose of this podcast, but you are one of my most inspirational patients. And through the fundraisers that were organized, based on the idea of you as a 13-year-old, we were able to help so many people. And I think that helped my advocacy blossom because I was advocating one patient at a time in a clinic. And through those efforts came the opportunity to have things like support groups. Because one of the things that came out of those efforts were you and your family asked, well, if you had some money to do anything that you wanted to with, what would you do? And one of the things I said was I would have support groups. And we organized the Songs for Sight support group. And that's been going gangbusters since 2009. Our next event is going to be this November. We have 3 events a year. And I've watched kids grow up through that program.
Yeah.
And so there's a whole cohort of people that are, similar in age to you that now come back and volunteer with us. And so they inspire me every day with the challenges that they face and the heights that they soar to. And then they come back and they mentor the younger children. And that really is what inspires me, is watching that whole cycle happen. And, it's just simply amazing.
I have to agree. It's pretty incredible to watch the growth and watch younger people come to maybe a camp or an event and they're so shy and so reserved and they have never met someone with low vision or blindness. And all of a sudden they have community and we get to see a whole different kid
Absolutely.
as they grow up. And it's just so remarkable to me.
And I just love that they not only do we get to see them in a place that's not a clinic where they can be themselves, but the bonds that they make at these camps and these events, they last all year long. And it's easy for me to empathize with somebody who has a vision impairment, but I don't have a vision impairment.
Right.
So I've never walked a day in their shoes. And to have a bad day because of your vision and be able to reach out to a friend who knows exactly what you mean is just really a powerful tool for these young people.
It continues to be for me, for sure. And I know you mentioned, camps and these programs are not in clinics, but I'm really curious about your work in the clinic, and especially for our people who are listening to this podcast or watching this podcast, and maybe they don't understand or haven't heard the term low vision. You gave us an example and you talked to us about how it's when glasses, contacts, surgery can't fix your vision. But what is the Low Vision Center and what was your work like there? What was a typical day in the Low Vision Center like for you?
So the typical day for a doctor in a low vision center is really different than the typical day for your average eye doctor.
Mm-hmm.
Number one, a lot of times I don't have to use dilating drops, which
everyone
makes the
loves
patients
you.
happy.
Yeah.
Yes. I do sometimes. It depends. If you have another doctor that's taking care of your eye health, then I'm going to focus only on your visual function. If you don't have another doctor taking care of your eye health, I'm going to focus on both because it would be really wrong to try to rehabilitate somebody who needed a medical treatment.
Mm-hmm.
So one time, one of the ophthalmology residents said, Dr. DeCarlo, you're 1/3 social worker, 1/3 psychologist, and 1/3 eye doctor. And that really is true because I get to spend an hour with every patient. So how many people have spent an hour with their eye doctor?
I was about to say it again for the people. 1 whole hour with each patient.
1 whole hour with each patient because it takes that long to understand what their visual functional needs are. It doesn't take me that long to understand the anatomy and physiology of what's going on with their vision problem.
Right.
But it takes longer because these eyes are attached to a human being, and every human being has different needs, different goals, different wants, different dislikes. And so we have to take some time to find those things out. And then we have to have the background to know all the tools that are available and the mechanisms to get those tools. So those tools are never covered by insurance, which is, that's a Medicare thing. If people are wondering why, basically Medicare says they only cover one pair of glasses lifetime after cataract surgery. Otherwise, they prohibit lenses from being covered, and that's written into their code. Well, every other insurance payer follows Medicare's example.
Right.
So those devices are never covered. And you would think if I have a vision impairment and I need this tool to function, how is it different than a wheelchair or a walker or some other prosthetic type device? And or durable medical equipment. Those aren't really prosthetics, but it is considered different in the eyes of Medicare. And so that's why they're not covered. So we need to know the resources to help people get the tools that they need to compete on a level playing field because those tools are out there, but not everybody can afford them.
Right.
So we have to know that. We have to know how to connect people to those services, and we have to really tailor it very individually. So it takes a whole hour, and I spend a lot of time after the clinic writing letters and things, helping teachers understand the vision of their students so that they can work with them in the classroom because they're going to spend a lot more time with that child than I am, and I want them to have the tools they need to help that child succeed.
Right. And I think, too, what people don't realize is, right, I was born with low vision, so I've never known anything else. But for your patients that might have lost vision or are just grappling with a newer diagnosis where they will lose more of their vision, what people might not realize about you, Dr. DeCarlo, is you really sit with them in some of those really challenging moments, right? And sometimes you're giving new possibilities to patients. And sometimes I'm sure you have to say, there are some things that will be more challenging, right? And holding both of those simultaneously sometimes in going from one patient saying all the things, here's all of these amazing possibilities. And then having the next patient say, oh my gosh, like these are some things like driving will not be possible in the near future because of X, Y, and Z, or whatever it might be. That's got to be challenging.
It is challenging, but I don't think I ever became hardened to hearing those things
Yeah.
because that's just not who I am. But I did learn not to cry with my patients. I'm a very empathetic crier.
Yeah.
And so if you're crying, I might just join you. But I did learn not to cry with them, but to make my office a safe space where if there needed to be tears, there could be tears.
Right.
And, sometimes when a patient realizes, they're kind of, a lot of times the low vision center is sort of their last ditch effort.
Mm-hmm.
The doctors have said there's nothing more medically I can do. Go see Dr. DeCarlo. She'll fix you up, which is the one thing I hate for them to say because they seem to overpromise what I can do sometimes. But I'm glad they're sending them because some people I can, give them all the tools that they need. And other people, the best thing I can do is to help them realize, no, you can't do this. But let's look at what you can do, and we're going to find something else that's going to make a difference. And unfortunately, I don't think Alie B ever wanted to be a neurosurgeon, but you don't have the vision to be a neurosurgeon. So
darn.
So we'd have to we have to sort of and figure out what things are possible, right, and how do we achieve those things.
Yeah. Oh, that's so important. One thing that I love about the Low Vision Center, and yes, while you're not there anymore, I loved it when you were there, and I still love it as a patient.
I'm still there half day a month, so
just kidding.
I can't leave entirely.
No matter what.
Yeah.
But my favorite part of the Low Vision Center is the room with all of the CCTVs and magnifiers and adaptive equipment to help people with low vision. Can you talk about some of the most common tools or low vision aids or devices that you often are giving or suggesting for patients and what makes them so neat? Because I think unless you know someone with low vision, you've never seen these things before. You don't even know. Like the glasses that I drive with, for example, all my friends who see them think they're the coolest, weirdest things in the world, but they've never known or seen them. So what are some common low vision aids that you swear by?
Okay. So yeah, that room has a sign on the door. It says Technology Center, but I always tell patients, okay, we're going to the Low Vision Candy Store. Let's go see what we can, find that's going to meet your needs. So in the last 10 years, the cost of electronics has really come down. I mean, we see that with our TVs. We see that with everything. And the most common type of equipment is really a video magnifier. And video magnifiers, like televisions, come in all different sizes. I mean, we can watch TV on our cell phone. We can watch TV on a 70-inch screen in our living room.
Right.
And the low vision devices are the same thing. So they basically work using a high-def camera and a screen. But the software that's built into these tools lets people manipulate the contrast, the colors that they're seeing, the background color. So some people who have glaucoma, for example, really like a black background with white letters because it takes away the glare, it maximizes the contrast. People with macular degeneration need more white background and blacker letters. And people who were born with vision impairment, most of them just like the regular old color mode because everything looks relatively similar, just bigger. So it's a matter of figuring out which size of those tools works for people. Anywhere from like a 5-inch screen to a 27-inch screen are the most common ones. And they cost, there are some available on Amazon that are pretty inexpensive, under $200. I really don't know about the longevity of those, and the image quality is not quite as good as some of the ones that
the fancy ones,
the fancier ones. But if it works for you, that's all that matters.
Right. And
so those 5-inch screens, you can get those for pretty inexpensively. A 27-inch screen is going to be somewhere in the low 3,000s. But these devices last a decade or more.
They do.
They are really hardy pieces of equipment, and they're not software bound. So it's not like, oh no, Windows just updated to 11. My computer can't do a Windows 11 update. I know a lot of people are experiencing that right now. So you never have the software update issues with that type of equipment. But sort of the next level up from that would be a device like that also scans the text and then can display it on the screen, but also read it out loud. So that uses optical character recognition software. And I really like that. If we're talking about kids, I like that for kids who are sort of struggling to keep up with reading, but want to be a visual reader. So we can make that print bigger and it can read to them so that they're getting the visual and the auditory input at the same time. And that also works well for seniors who say, a lot of patients, I can get them a free copy of the Bible on tape. Easy. But a lot of people, especially in Alabama, they want to see the word. They don't want to just hear the word.
Yep.
And so that OCR combined with the video magnification can be life-changing for people who need that combination. And those are a little bit pricier than the others. And then there are some types of equipment that, there's one that attaches to the temple of your glasses and you point at something and it'll read it for you.
I think that is so cool.
It reads it so well. But there are free things too that we work with people, built into your iPhone or your Android phone are different softwares that will turn that into a video magnifier too. The difference is that they don't have quite the level of image stabilization as dedicated devices.
Right.
But in a pinch, in a restaurant, in a store, they work pretty well.
I remember thinking, because I have a video magnifier myself, I don't want to carry this around to every restaurant. And then you said, yeah, you just have an iPhone. And it's like, I didn't even realize that there was a magnifier app that I could use. Yeah. So I think that's so important. I also know in the low vision candy store that you mentioned, there is VR equipment too. Will you tell me a little bit about that?
So there has been a big push over the last 10 years or so to get more head-mounted low vision devices. And they're out there. I'm just not finding a lot of patient acceptance of them.
Yeah.
And I think number one, if you think about, what an Oculus headset looks like, it's cool to be playing that if you're gaming with your friends, not cool to be wearing that out to dinner kind of thing. So and some people get motion sick and other things. So there are a number of those available, but they're just not very popular with patients. They prefer the desktop or the handhelds for their magnification. Absolutely. Although I do know people, and I think you're one of them, who've told me like watching TV in one of those is a game changer. It's the
best thing I've ever done. Yes, it's really incredible. And I think that's what's so interesting about what you do is, yes, there's all this technology out there, but every individual is so different in what they need and what they're comfortable with and what technology they'll use. I know when I was younger, I never wanted to use any of my technology, and you'll tell everybody that because
I'm a tattletale.
You are. But now I'm down to use just about anything and try just about anything because I know and recognize that even a slight adjustment or help for me is worth it. I'm curious too one thing that I think is so cool about the Center for Low Vision Rehabilitation is you have things like a kitchen where people can learn and find even smaller little devices to help with activities of daily living, which is really important.
So there are a lot of things out there that people often don't think of on their own that are just really simple, quick, easy solutions. If you're having a hard time measuring, is this the half cup? Is this the third of a cup?
Right.
There are color-coded labels on some measuring cups that you can go buy at Walmart. I mean, they're not doing it for low vision purposes, but it works really well. And
Absolutely.
Having a set of white ones and a set of black ones, if you're trying to put white flour into a white measuring cup, doesn't work very well. But if you're putting it in a black measuring cup, you're going to see it. We sometimes tell people to add extra lines using a puff type paint onto their measuring cups, because measuring cups are, clear for liquids, and those little red lines are terrible to see. So we teach people how to adapt their own things. There are tools. There's a tool called a Say When device, and you just hang it over it's got a 9-volt battery on it, and it's 2 little prongs, and you hang it over the edge of your coffee cup. And when you pour your, or any other cup, when you pour your liquid in, when it reaches the level, it will beep because it creates a circuit between those 2 little prongs. And that's just called a Say When device. And a lot of people with vision impairment just like hook their finger over the edge of the cup and pour until it's full. And that's pretty good if you're pouring your own drink, but if you're pouring somebody else's, the say when device looks a little more sanitary.
Correct. I would go with that method too.
Yeah.
Well, we're going to be back in just a little bit to talk about your work today at Sight Savers, but we're going to take a quick break.
At Lakeshore Foundation, we believe in a world in which every person has the opportunity to achieve a healthy, active, independent life. For 100 years, we've been impacting lives through inclusive fitness, sports, and recreation. Our mission is to encourage and provide opportunities for people to live a healthy lifestyle through activity, research, and advocacy. Join us. Together, we can make every day a new beginning.
All right, so I know that you are the CEO of Sight Savers now, but I'm really curious on your journey to getting there. I know that you'd worked with Sight Savers in the past, and I'm so curious when you left the Low Vision Center, not left because you're still there, we learned. However, what inspired you to take the leap to the CEO position at Sight Savers?
So Sight Savers was founded in 1997 by Jeff Haddix, who was a vision scientist. He did cornea research and immunology. And I worked with Sight Savers ever since they started providing high-tech equipment to children with vision impairment. So I probably referred more children than any other doctor on the planet to them. And so we had a close working relationship because of all the referrals. And as I said earlier, the equipment's not covered by insurance. So imagine, being a young family. Young families don't have $3,000 of disposable income most of the time to buy a tool that their child with a disability needs. And, so those referrals were just a key part of what I did, was connecting the organization and the children who needed their help. And so as Jeff started approaching age 70, he realized, he can't be CEO forever. And he wanted somebody who understood eye care and who had the same passion for helping people that he did. So he started approaching me about this. And we had many talks in coffee shops outside during the pandemic. And my family encouraged me to make a change. I had done the Low Vision Center for a long time. And I also had the good fortune of training some fellows that stayed on. And so it was good timing because I knew that Dr. Marissa Losi was going to take over the lead, and she's now your doctor, and she's fantastic.
Love her.
And Dr. Elisa Gostinelli was going to be there, and we had a new fellow that was training that year, Dr. Brooke Gibson, and so she's stayed on. And we have a fellow this year, Megan Jacoby, that I get to work with on the limited times that I'm there. So I felt like the center had grown to a place, because when I got there, the center was still struggling. It was
you.
Yeah, we grew it. And it was a lot of support from the Eyesight Foundation, a lot of support from Callahan Eye Hospital, a lot of support from the Department of Ophthalmology, specifically Dr. Lanning Klein, and then Dr. Chris Gherkin, and now Dr. Brian Samuels. So all of those people helped the center get to a place where I knew it was going to be in good hands, because there's no way I could have left my baby not in good hands.
Right.
So the timing of Jeff needing somebody, knowing that the center was in good hands, and, sometimes you have to know not to overstay, because what if I stayed and then I didn't have good hands to turn it over to?
Right.
So the combination of those things just made it an ideal time to sort of to shift and to work full-time for Sight Savers. And that's what happened.
I know Sight Savers has 3 distinctive programs. Can you talk about each program and what you love about them?
Yeah, so one of the really unique things about Sight Savers is our eye care program. And so in the state of Alabama, every child in kindergarten, 2nd, and 4th grade receives a vision screening while they're in public school through Vision Research Corp.
Wow.
Every child who fails that vision screening gets referred to Sight Savers America. And we have a whole team of case specialists. Each child is assigned their own case specialist. That case specialist reaches out to the parent to make sure that the parent knows the child failed the vision screening, to find out, because, things go home in backpacks. They don't always get seen. My kids used to hide things from me, like their school pictures. So we make sure the parent knows the child failed the vision screening. And then we ask them, do you need any help getting your child to an eye exam? And there are a lot of barriers for parents, especially parents living in rural under-resourced areas.
Right.
And so if they're eligible for Medicaid and they're not enrolled, we can help them enroll. We can get them an appointment with a doctor who sees children. Not all eye doctors see children. So it can be frustrating for a parent to be calling offices and saying, we don't see kids, we don't see kids.
Yeah.
And if they're uninsured, we'll pay for the exam, or we have a whole network of doctors that donate a few exams a month or give us reduced costs so that we can help more kids. And we make sure that kids have, the best corrected vision possible. And that's really important because there are a lot of kids who do have the capacity to have quote unquote perfect vision, but don't have it for lack of a simple pair of glasses.
Right.
And that makes a huge difference for those kids. And so that's our eye care program. And our case specialists, I refer to them really as motivational health coaches, because they're removing all the barriers and they're educating the parents, and they're making a difference in kids' lives every single day.
Yeah.
So that's the sort of the program that started it all, because it all started when Jeff went to the ARVO conference, which is a big eye research meeting, and they were talking about the amount of vision impairment due to uncorrected refractive error in developing nations. And Jeff started thinking, and what about some of the poorer neighborhoods in Jefferson County? What about some of the rural places in the state of Alabama? And first year he helped 5 or so kids, and it's grown to helping thousands of children every year. And then our screening program is our smallest program. We screen about 30,000 kids a year, and these are all through private foundation grants that we get. Most of the screenings are many of them are in preschools and daycares, because if a child has a vision problem and it's not corrected early on, sometimes that leads to a permanent vision impairment. That's in a case of a condition that we call amblyopia. Basically, one eye is getting better input than the other to the brain, and so the brain only pays attention to that eye. And after a certain amount of time, the other eye doesn't have the capacity to make those great connections. So early detection is really important, and our screening program screens about 30,000 kids a year, but our case management program manages about 50,000 a year. So we're getting referrals from many other organizations like Impact America's Focus First program, which screens preschoolers throughout the state, and Vision Research Corp that does the school children. And then our third program, and the program that really got me involved in Sight Savers, is our low vision and blindness program. And in that program, in Alabama, we serve both adults and children. In new areas, we typically only serve children. And the number of people we serve is dependent upon the number of grants that we can get. So we are constantly writing grants. We have a grants department that submits a grant. It feels like
every week.
Oh no, more
Every
than every week. Much more than every week. So we submitted somewhere between 150 and 200 grants last year.
My goodness.
And those grants, every dollar of those grants is spent exactly the way we promised the funding agency that we will. And for some of the organizations, we're purchasing high-tech vision equipment because we buy in volume. We get a nice discount that lets us help more people. And we then provide the equipment that they need in addition to the training. And for children who receive this, we call 2 weeks after they get the training, and they take their device home, and we make sure everything's going okay. And then we call in 3 months, and we do a Likert format survey. So that's the 1 to 5 scale kind of thing, and ask questions about the impact that it makes. And the most impressive thing about the impact that this equipment makes on kids is that, we see improvements in reading and we see improvements in writing. I mean, those are kind of expected and not overly thrilling to me. I mean, I'm happy that it happens. What thrills me is that the biggest improvements happen in self-esteem and independence.
Yep.
And those are priceless for a young child who is struggling with a vision impairment, to let them have their independence. I don't have to get mom to read the instructions on the brownie box. I'm going to make those brownies myself.
Right.
So that's, an extremely rewarding program. And we, in the last fiscal year, so our fiscal year ended October 1 and, or starts on October 1, we gave out 457 high-tech vision aids last year.
Wow.
169 of those were to Alabamians.
That's incredible.
So and every time I go to a clinic, my heart is just so warmed by the expressions on the kids or the adults' faces, and the things that they can now do.
Right. I think that's the cool thing that we don't even think about with some of these things like video magnifiers or different telescopes. I remember the first time I learned that my video magnifier could help me do my makeup. Right. I was amazed. I was like, this just changes the game for me as someone that's in the arts and has to always have a face on. Like, this is so cool. I never thought I could do this, or I'd always need to ask for help. And again, it's just that amazing feeling of independence, even on some of the smallest things. It's huge. Or using a telescope to read a menu that's posted up on the wall somewhere, which of course now we all have our phones, but back in the olden times,
right,
you had to pull out your telescope. So I think that's just so unique and so cool. Where do you see the future of Sight Savers? What are some of your big dreams and goals for the organization?
So, I hope that we can keep getting foundation funding at the levels that we have.
Mm-hmm.
I would love to be able to help more adults. In Alabama, there should not be a single child living here that needs this type of equipment that doesn't have it. So we call that sort of our elimination phase, when we've gotten every child who needs it what they need something what they need. But of course, there are always new children being born. There are new children moving to the area. There are
Right.
children who develop a new eye disease. But what we've discovered over the years of operation is that need is only about 10% of the original need. So now if we can achieve the same level of funding, that other 90% of the funding can be used to help adults. And many adults with vision impairment are underemployed or unemployed.
Correct.
That means that affording this high-tech equipment is next to impossible for them. And that is actually a hard group to find foundation funding for. It's, when you're writing grants, you have to tell a compelling story.
Correct.
And it's easy to tell a compelling story to help a child succeed in school. About a third of children with vision impairment don't get their high school diploma.
Wow.
Nationally, I don't believe it's that high in Alabama because we have organizations like Alie B here that do amazing things. And so I don't believe it's quite that high in Alabama, but that's the national statistic. So that's a compelling statistic to be able to put in a grant and convince a foundation that this is worthwhile. And then for seniors, it's easy to write a grant that says, well, many of these seniors, if they can't manage their own medicines and they can't pay their own bills, they're not going to be able to live independently. But this is a vision issue, not a cognitive issue, not a physical issue. They have the capacity to be independent if we provide them this tool.
Correct.
Another easy sell in a grant proposal. But for, a working age person, Voc Rehab will give you the tools that you need to work, but not necessarily the tools that you need at home. For example, I always struggled with stay-at-home moms. So I was a stay-at-home mom for exactly 1 year while my husband did a postdoc in another country. It is the absolute hardest job I ever did. And so for all those stay-at-home moms that need a tool to be able to check their child's homework, so the future I hope is to find funding for that middle ground of people who need tools, don't make enough money to afford them, and aren't in a group that there's other resources for. So we are trying to bridge that gap at Sight Savers this year. We're doing much better this year at bridging that gap, but I think that's a big gap.
That's incredible. I hear you. And I think that we don't even consider all the different activities we have just to get ready for the day or get kids ready for the day or, help with a pet or do whatever it is. And so many of these daily actions, there are tools that can help, but we have to get the right tools to the right people. And I'm so grateful that we have people like you that are doing this every single day and that are so committed to this work and are advocating for people to be able to experience the level of independence that they want to experience, right? Everyone also is going to want different levels of independence. Not everyone is going to, or even just because you helped me figure out that I could drive a car with this technology doesn't mean that it doesn't scare me sometimes, right? Right. Hate to say it, but it does. So again, just because certain things exist doesn't mean everybody is going to have the same wants, because again, knowing one person with a vision impairment is just knowing one person. So I'm just so grateful that we have people like you in this world working to make sure that everyone gets to experience their own levels of freedom and independence that they've always dreamt of.
The other thing that I would really like to see Sight Savers do is there is an epidemic of myopia. And so myopia is a fancy word for nearsightedness. So that's people who can see up close, but everything far away is blurry, and glasses can fix this. And it's affecting people at younger ages. And some of this has gotten worse since the pandemic. But if you think about what happened in the pandemic, everybody got a screen.
I was about to ask if this was screen related.
So we don't have proof that it's screen related, but we do associate increased levels of nearsightedness with indoor time. So more outdoor time, less myopia. Well, if you're on a screen, you're not outdoors.
Sure.
So I would really like to see, especially in Alabama, us add 6th grade statewide to vision screenings. Sometimes, myopia comes on gradually. Sometimes a child doesn't realize they're not seeing the way they're supposed to be seeing. And, you all hear stories about the person who got the glasses and they went outside and they're like, oh my gosh, there are leaves on the trees.
Exactly.
And that, I think adding 6th grade is another important goal for Sight Savers.
That's huge. And imagine getting screened in all of those different grades and having so many entry points. I mean, that's so, so important, especially as kids go into middle school.
Yes.
Thank you so much for being here and for sharing. If we want to learn more about Sight Savers, or if listeners are curious about what you do and want to get involved somehow, where can they look?
So we have a webpage. Hope we're going to be improving it a little bit this year, but there's a lot of great information on there. It's just sightsaversamerica.org. There is a news section. We make the news fairly frequently. If you want to know about the low vision equipment in particular, under our news section, there's a link to a clinic that we just had in Houston, and there's a 4-minute video there where they really talk to the kids and they talk to the parents and they show the devices. And I think that's a great place to learn about what we do for people with vision impairment. The other thing, I just want to pop this in here real quick, is that we didn't talk at all about Braille, but there are very fancy devices that can Bluetooth to your phone or your computer that have refreshable Braille displays, and Sight Savers works with those as well. So it's not just people with vision impairment. There is a lot of great technology out there for people who are blind.
That's so important. I've seen some incredible Braille displays from people I know that are blind and deafblind, and I'm just blown away at how it all works.
Yes.
So thank you so much for all the great work that you do. And thank you for joining us in person today in the studio. We're just so grateful. And I'll always remember the day that you told me what I would be able to do instead of telling me what I wasn't able to do, and how much that changed my life.
Well, thank you so much for having me. I never turned down an opportunity to hang out with Alie B.
Oh, thank you. Thanks for joining us for another episode of Nothing Without Us, a disability advocacy podcast produced by Lakeshore Foundation. If you liked this episode, please share it with friends and family, and be sure to follow our podcast and subscribe so you never miss an episode. Also, if there's someone in the disability community that is doing incredible work that you would like to learn from on our podcast, please let us know. Send us a DM or an email, and we would love to learn who's inspiring you. We look forward to being with you again soon.
Nothing Without Us, a disability advocacy podcast, is produced by Lakeshore Foundation, Alie B, Terry Scrimshire, and me, Patrick Tomley. For more information, visit lakeshore.org.